Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in and welcome to This Justin Radio. I'm your host, Justin Barnes, and we're broadcasting live from the Health 23 conference in Las Vegas. Very excited for this next 2 days of broadcasting from the most exciting digital health and health IT conference in America. My lineup of guests is unparalleled, so stay tuned to hear the fastest voice in healthcare speak to this amazing group of leaders and innovators. We're broadcasting here from Health 23 in Las Vegas. Very excited about my next guest, Howard Burde from the Howard Burde Law Firm. Thank you for joining me, my good friend.
And thank you, Justin. Always a privilege to be on the air with you.
You're one of my more frequent guests as well, so thank you for always making time. So before we dive into all these great questions, when did you get in town, and you having fun so far?
Oh, absolutely. As you know, I think this is a premier healthcare conference.
Absolutely.
And you and I have been doing this for decades now. This is where we see a lot of our friends.
Absolutely.
So in addition to the business and the show, there's the sense that we all have a network that we not only tap into, but feed and grow and nurture at Health. So it's always a special occasion.
Very true. And so actually, I forgot this, but this is, you maybe just think of it now. Howard was the reason we took the radio show on the road. You reached out to me in late 2014 and said, hey, Justin, what about bringing your radio show to the HIMSS Venture Forum in Chicago in I think it's early 2015, but we started talking about it in 2014, late 2014. And I said, what a phenomenal idea. But the Business Radio X crew, and we all went up to and brought a remote studio and remote broadcast. And it could not have gone off more seamless. I mean, I literally had a 2-hour straight show, and I didn't think I could do it. God gave you the gift, but it just went 2 hours straight broadcast, back-to-back guests, rolled through. You made it so perfect for the setup, but also you helped me with a lot of those guests, and that was perfect.
Well, sometimes it's fortunate that I have a good idea. Usually I have one idea, and I hope it's a good one.
You always have great ideas.
And frankly, look, I was the founder of the HIMSS Venture Programming and the HIMSS Entrepreneurial Programming, and we might as well say now, all of which is here at Health. And your participation, bringing the radio show, made that event better. Yeah, it improved it. It raised its valence in the health business ecosystem.
Thank you, my friend. Yeah, that was a ton of fun. That gave me a lot of confidence, realizing I could do, again, a 2-hour straight broadcast. I think we actually pushed it because we had we ended up bringing one of the winners of that venture forum onto the show, Tower Health or something like that. Tower Health, Jitten or Jitten.
I don't remember which one, but I do remember
we made room for him at
that
the end.
Year after year.
Yes, we did it. Yeah, always run the winner in our air, but we did not have that person scheduled. But we ended up making room at the end of the show. I think we brought you and him on the end of the show after the 2 hours with our broadcast. So we went 2.5 hours that very first show, but it worked out swimmingly. So obviously we're here, Health 2023 in Las Vegas. So what are you seeing for healthcare? Healthcare trends, digital health trends. So what are you seeing out there, my friend?
Well, I see a couple of things. First, this is very clearly the premier event for the development of healthcare business, and I choose those words advisedly. Right? J.P. Morgan is a huge health conference. J.P. Morgan is the car you drive when you've already arrived. Right. It's for big companies that are already there. Right. How are they going to trade? Who's going to merge? And who's going to buy out? Yeah. This is for the companies as they grow. Right. This is how you get there. And so that's the first observation. The second observation is we're starting to see, I think, I don't know if it's a return or a renewed focus on the importance of services at the end of or as part of whatever the technology offering might be. And, how does the patient experience matter? How does the technology incorporate patient experience, provider experience?
Absolutely.
How does that work? And I think that's my primary observation. The second observation, we're starting to see the integration of what I'm calling whole health, and that's probably the wrong word for it.
It's a good word. I like it.
And the idea that we are not a combination of a variety of systems. We are integrated systems, right? I mean, the neck bone's connected to the backbone, but gut health is related to brain health, right? Heart health or oral health is related to brain health and gut health, et cetera.
And heart health.
And heart health.
Yeah.
You can't separate logically all of those factors. So the idea that care needs to be managed and coordinated is coming back. Okay, is it new? We went through this in the 1980s with the Federal HMO Act. We went through this 25 years ago. Healthcare being cyclical always comes back to good ideas. And I think we're seeing that here.
Yep. Phenomenally well put. So what are a few best practices that you can share with my audience on how to navigate some of those trends and what you're seeing out there?
Well, let's ask who the audience is for that question first. Who would you like me to address?
Well,
that
I mean,
to?
I think you have it twofold. I have a lot of patients that listen to this show, and so I think you just give some really good examples on how we can take better care of ourselves and how our whole body, the whole health, is connected. But then also we have a lot of innovators and technologists and vendors even in health systems that listen to the show. So from their perspective, they aren't attending HIMSS, but you covered a lot of good ground there. So I mean, from however you want to kind of handle it.
Okay, so. And I'm the worst person to give this
and I
advice.
love the whole health piece. I don't know. Yeah.
Well, and again, I'm the worst person to give that advice. I turned 60 last November.
And you're still alive. So
and
you're doing something right.
Well, I had my decennial checkup. And the doctor assured me that if I continued to go to the doctor every 10 years, I would likely not make the next one.
There you go.
So,
Smart man.
So the first thing is, we have to take care of ourselves.
Yes.
Each of us individually and each of us as part of the family, as part of the community. And there are simple things that matter. Right? Eating right matters.
Yeah, it does.
It just does.
Yeah.
Exercising, getting out and walking, doing whatever you do matters.
I do 11,000 steps minimum a day. Absolutely.
And you count them.
Yes, I do.
I just walk until my knees hurt. Yeah, I mean, I can't do the things I used to. I would love to go out and play squash every day. I can't do that because there are no old squash players, right? We're the ones who limp.
Yes.
That's
great.
So that's the first part. The second is, and I think on our panel, for the audience, you weren't here, but Justin and I were on a panel, each giving one big idea to healthcare entrepreneurs. And I think the idea is that if you're going to be in the healthcare ecosystem, have an idea that is solving a problem worth solving.
Yes.
And test that idea. Listen to the customers and the feedback.
Got it.
This goes back to, I learned this in kindergarten. Listening is really important.
Yes.
And it matters.
Really?
And so if you're building a business, listen to criticism's healthy.
It is.
Right?
Yep.
So learn to incorporate that, not responsively object. That's criticism.
Yeah.
No, it's criticism is medicine for the business soul. It's how we learn, how we grow.
Amen. So true. So, and I, on that panel, I talked about execution and how ideas are easy. Execution is everything because it goes back to, you got to be solving a real problem today that people, that's a real pain point. I think you brought up reimbursement. You got to make sure you're in healthcare. You want to make sure your idea follows reimbursement, at least does not get in the way of reimbursement.
Well, let me use the line. Reimbursement drives the system.
There you go.
Okay?
Yep.
And that is true in the United States a little more prevalently, but it is also true in every Western democracy. So even those that have, and before we get to an argument about single payer, every Western democracy has a mix of private pay and and government paying systems. It's a matter of how they're mixed.
Yes.
And in every single one of those, there is some form of determination of what technologies and what services are available. So they have to be paid for, whether it's in the United States or Canada or in Europe, right? There's always a determination. So before you build something, you need to be looking down the road.
Right.
Who's going to pay for this?
Yeah.
And if you're selling to doctors or to hospitals, the hospitals have to know that an insurer is going to pay for them to use whatever it is you're selling.
That's right. Very true.
And so reimbursement drives the system. If you ignore that,
You'd be in trouble.
you build shiny objects, right? And that's fine, but you're not in business very long.
Right. Not going to build a billion-dollar company like a lot of us want to do. So in our last couple of minutes, I do want to, this kind of navigates into the last question, thinking down the road. I know you've got a very cool new venture that you've helped to create, Gray Matters. I love what you're doing. This totally feeds into the next 2 to 3 years in healthcare and where we're going as a society. It was just World Alzheimer's Day. So why don't you tell us, in the last couple of minutes, give us some best practices there and what you're doing, then also some best practices there.
Okay. Well, as the 3 or 4 people in your audience out of the millions of listeners who know me, my professional world has 2 parts. I build healthcare businesses. People come to me with ideas, with small businesses, with technologies, and we work together to get them into the system, to create their universe. Mm-hmm. The other part of my professional world is I'm a founder of a very small number of healthcare businesses, mm-hmm. the most prominent of which is Gray Matters, which is a dementia clinic company. We work with patients from hopefully before they have symptoms, but certainly once they're symptomatic, to help them address those issues. And we do it by addressing the source of the problem. For years, based on flawed research, the thought was that amyloid plaques in the brain cause dementia. Well, something causes the amyloid plaques in the brain.
Right.
Merely getting rid of them, as some of the recently approved drugs do, is insufficient, right? That's, like giving somebody on blood pressure medication cheeseburgers for dinner. It doesn't work. So what we do is we address at Gray Matters the underlying causes, to the extent they can be identified, of dementia. That can be heart health, certainly. It can be diabetes or prediabetes. It can be vascular health. Mm-hmm. It can be infections. It can be, especially oral infections are prominent. In places like Florida, where there are lots of older people, yes. If not the initial cause, mold infections are if not the cause, at least the exacerbating factor. And removing mold from their environment helps people's health improve. So our idea, and I'm going to get to the kicker here in a moment, is that we use primary care to address those issues. How good an idea is this? Well, the Medicare program on July 31st announced that it wants to put all Medicare fee-for-service patients who have a dementia diagnosis at any stage into what they call the GUIDE program. And if you were to put the GUIDE program as an overlay on top of Gray Matters and what we do, it's an exact fit. So we're very excited. We'll be applying to be a provider in the GUIDE program and hopefully to grow our services across the country by managing the health and helping people with dementia, their caregivers, their families, helping keep them healthy, make them healthier, and help them through the system. So that's what Gray Matters does.
Love it.
We're very excited about it.
Congratulations. I love it. We're at time. Howard Burde, always a true pleasure to have you on air, my friend. You're always a great, phenomenal guest.
Thank you, Justin. It is a great pleasure.
And I'm sure we'll see you at Vive too, right?
But of course.
Absolutely. All right.
Thank you
so much, Howard.
Bye-bye.
Take care, buddy. Very excited for my next guest, Matt McCormick from Amwell, Group Vice President, but also to talk really about what you guys brought here to the conference and the cool initiatives and announcements that you've got going on. So very excited to have you here, Matt, on air. So first, welcome to the show.
Thanks, Justin.
Great to have you here.
Yep.
Thank you. And you're standing in. Roy got sick, so I'm glad that you could certainly step in here And again, we're able to catch up off air a little bit. And so very excited for this segment in which you guys are doing, not only nationally, but also globally. So I look forward to diving into that in a little bit. But since you're a new voice to my show, where'd you from, grow up, those kind of good things?
Originally born and raised in Miami, Florida. Lived for about 20 years in the Atlanta, Georgia, Athens, Georgia area. And then I've recently relocated back to Florida, so couldn't get away from the warm weather. So
yes, well, the great taxes too.
Yeah, that's also a big help.
Even though no one else listening to this, don't come to Florida. We have a lot of people there. We love it. It's been a little bit overrun, but
1,000 new people a day or something crazy like that.
Great state. I live in Florida now too, in the Sarasota side. Terrific. Is this your first health conference or your second one? Or?
This is my second one, yes. I actually enjoyed being here. Great atmosphere. The way they set it up, it's really amazing. It really kind of lends to us engaging with our fellow partners and others in the healthcare industry to learn what's going on out there.
Yeah, Rich Scarfo was my guest yesterday, the president of health, and he's just done he and the team have done a great job creating such a collaborative space. So bringing together, mainly C-suite. A lot of, C-suite executives are here, and just having the right people at the right time in the room, and having a ton of collaborative space. I actually had an hour free today. It was kind of nice to walk the show around lunchtime and just have tons of time to spend with other people, but also tons of space to find places just to kind of sit down and collaborate with people. And I know Rich and the team done a great job kind of building that environment around here. Yep. So, starting off, what have you seen for some healthcare trends, digital health side or healthcare that you've seen out there in the industry?
Yeah, I think the industry's gone through a lot of transformation lately, especially post-COVID. I mean, I think that accelerated the whole industry decades, as we know. And what we're seeing is that it kind of, weeded out the weak ones, I guess you would say, but it also stressed and pressure tested the existing ones to see if they could handle that of impact. And the ones that have kind of survived have also gone through this transformation of being able to adapt and transform and really kind of go from just being a telehealth company and even further than being a digital healthcare company to being something a little bit more transformative, with a kind of a hybrid care approach, more of a hybrid care partner is really the way we kind of see the industry evolving, where we can bring, we have developed a world-class platform, tremendous endpoints. We have clinical services at Amwell that address a bunch of different therapeutic areas. And I think it's key for us to be able to empower our partners to be able to utilize these services, meet the patients where they're at, and provide them that world-class service that we need to in order to have an impact and kind of move that needle on the healthcare side. And to maximize the resources. We see everything going on out there that the lack of the physician shortages, the nursing shortages, there's just shortages across the board. And again, everything was, exponential coming out of hybrid. They had that kind of perfect storm where you had that huge need, but also a depletion of resources at the same time. And so what it allows the industry to do is to really show what we can do and how to maximize those resources and be able to take, we're not going to be able to create more doctors like that. We just can't do it. But we're going to have to maximize the resources that we have and then supplement them with automated care and digital components and things like that.
Yep. And your personal focus on behavioral health side, is that correct?
I am the group vice president over Amwell's behavioral health, and we've invested almost $1 billion in the last few years in building out the behavioral health division. Roy and Ito had the foresight to kind of see this perfect storm coming, again, which was exacerbated by COVID. I think pre-COVID, it was about 1 in 5 people had a diagnosable behavioral health issue. Coming out of it, it's closer to 1 in 3. About 65 million right now, just in the U.S. So it's really a huge need. And the other thing is, our psychs are aging out too. So about 2/3 of them are going to be retired in the next 10 years. And we're going to have a depletion of about 100,000 psychiatrists that we're not going to have. About 60% of our counties currently don't have any sort of psychiatry coverage or anything at this point. So it's a huge, huge unmet need. And Amwell's invested, millions and even up to $1 billion doing this. And what we've done is built out couple different things. On the services side, we built out our animal psychiatric care, which goes to kind of the high acuity, works within hospital walls, any four walls, either EDs, hospitals, IDNs, anything like that. We provide that service on an on-demand basis or scheduled outpatient basis. We got about 350 providers there. And then the other thing we did is we built out our animal medical group, which is our kind of direct-to-consumer medical platform. That has about 5,000 providers nationally. About half of those are primary care, urgent care, and then the other half are some sort of behavioral health, and this is more therapy, counseling, psychology, some psychiatry, med management, things like that. So we're trying to work at it from a couple different angles to really meet those patients on where they're at and where they have the needs.
That's excellent. So in kind of following that train of thought, what are some best practices that you can share around behavioral health and telehealth and how this all comes together in this type of a platform? But are there certain strategies or support mechanisms for these communities that you guys offer? Yeah,
there is, and it's apropos that we're talking about this on today with it being World Mental Health Day. So that there are some things that we've done that really kind of, as we're building this out, as you talked about, different venues and different ways for us to get these services to the patients that are in need. And like I mentioned, our animal medical group and our APC group, our animal psychiatric care group, we also have a digital component as well with one of our two other of our acquisitions. One was Silver Cloud by Amwell, which is digital CPT or digital cognitive behavioral therapy that has been around for 20 years, was based in the UK and is now global. We'll talk about some announcements that we have around that we just announced today, that we're expanding into the South African market with that. Yeah, so trying to impact about 1 million patients down there with our partners, Discovery Health. And this allows, what this does is we're combining this to form our digital behavioral health, combining the digital ICPT program with an automated care program as well, which was another acquisition we had, which was Conversa company that allows for that AI component, that chat component, to really kind of be the glue in between visits or to prevent the patient from winding back up in the ED. So it really has those touch points while they're going through either the digital CPT program as part of their discharge protocol, or it can be, that just to remind them, hey, you've got an upcoming visit with your therapist coming up. Hey, have you taken your meds? How are you feeling? And it allows us to kind of keep that patient engaged throughout the process without them. And then we also have the ability, if there's an escalation, if somebody has suicidal ideations or things like that, and it kind of shows up in the digital chat, then that'll be escalated either to 988, the suicide hotline, or to a provider on our staff, or to a provider on one of the hospital staff, or things like that. So we're really trying to make that difference and make it a comprehensive coverage, really from end to end, from high acuity to lower acuity, and pretty much anything in between. It's kind of AMO's goal with the behavioral health.
Excellent. Well done. World Mental Health Day. This is terrific that we're here on air now. Very serendipitous. So this next piece my audience loves. It usually becomes its own segment, talking about basically the crystal ball and looking into it and kind of looking out 2 to 3 years in advance. I know it's a hard question, but thinking about the future of where either behavioral health and mental health, or where telemedicine, telehealth is going to go in the direction, and how it enables a lot in our care strategies. But thinking ahead, what are some of your thoughts there the next couple of years we should be looking out for? Yeah,
I think we need to still be advancing down the road. I see us advancing down the road is that hybrid care where, I had one mentor tell me this. I've been in the industry about 12 years. He said one day this will no longer be called telemedicine; it'll just be called medicine.
Right.
And this is just another tool for us to use, like a stethoscope or something like that. And that's where we become truly integrated into the healthcare system, and it's not seen as a third party. Just having a connection and a doctor on endpoints and things like that. That's table stakes to get in right now.
Yes.
You've got to be able to advance that directive down the road a little bit. You got to be able to make sure that the patients are getting this combination hybrid care. We're not going to replace, and the goal has never been to replace in-person care with what we do. It's to enhance it.
Yep.
And I think that's where we have to go. And now that I think that mindset is kind of starting to settle in with the providers across the board, they're not seeing it as a threat as much anymore, but really as a tool for them to be able to use and to maximize their skill set, allow them to practice at the top of their license.
Right.
So they're not driving windshield time and all this stuff. They can be in 4 different different clinics in 4 different days and be very efficient at that by utilizing the resources that we can provide.
Yeah, 4 different clinics in 4 different hours. You know?
Exactly.
Yeah, no,
exactly.
it's very impressive. Yeah. No, I know, it's great. No, and I think that we've all seen where, integrating, telehealth, telemedicine into the overall care strategy it's just part of where a lot of and that's been my healthcare, to be honest, for the past 4 or 5 years. I mean, I see my providers in person probably once a year for annual physical, but that's about it. Everything else is done remotely. I have a great care team that manages my care, again, all remotely, all through, telemedicine, telehealth, and secure texting.
Yeah.
So I don't really need to be there. The in-person visit's not conducive to it. My doctors are still in Atlanta when I primarily live in Florida, but I leverage technology and innovation at every turn.
Yeah, it makes us much more efficient.
Absolutely. So I guess in the closing minute or so, I think, any announcement that, I know you mentioned this new initiative in Africa, but anything else you want to share with my audience just in the last couple of seconds here?
Yeah, I mean, again, I wanted to kind of expand on that a little bit on what
please.
we're doing. So Silver Cloud is our digital CPT program that we talked about. It is used by the National Health System in the UK and HSE in Ireland, and we're in Australia with a partner called Honeysuckle. And then, like I said, today we just announced that we're with a partner, Discovery Health, expanding this into the South Africa market, and we're excited about what that's going to do. We're looking at growing that partnership with Discovery Health, and they are one of the world's largest, payer providers outside of the U.S., and we're excited about this partnership and where it's going to take us.
Fantastic. Matt McCormick, thank you very much. Amwell Group Vice President, thank you for joining the show, and thank you for lending your voice to us and your thought leadership. Greatly appreciative. Thank you very much.
Great. Thank you, Justin. I appreciate it.
My friend. Thank you. Take care. And that's a wrap. What a great series of shows and guests. Always grateful for them joining us on air. And thank you to all of you for joining us. What a great lineup. But what a great show we've had here in Las Vegas. But look forward to us coming to you live from Vive in Los Angeles in February. So look forward to that and see everyone then. Take care.